So now what is the process of dialysis? It is one needle will slowly remove the blood and transfer it to a machine called dialyzer or dialysis machine. This dialysis machine is made up of a series of membranes that act as a filter and a special liquid called a dialysate. The membrane filter waste product from the human blood which are passed into the dialysate fluid. What happened when the dialysis no longer works? Without the dialysis, toxic build up in the blood causing a condition called uremia. The patient will receive whatever medicines are necessary to manage symptom of uremia and other medical condition depending on how quickly the toxic buildup which causes death usually follow anywhere from a few days to several weeks. Now we are going to learn it. What are the side effects of hemodialysis? So side effect of hemodialysis produce low blood pressure, and low blood pressure is one of the most common side of effect of hemodialysis. Sepsis, second one is sepsis. The people receiving hemodialysis are increased of developing sepsis, that is a blood poisoning. The name is called sepsis, is called a blood poisoning. Another third effect is called muscles cramp. Okay, because we are injecting catheter into the muscles, suddenly it will get a cramp. Another one, itching sensation over the skin, and also other side effects also will be there during the hemodialysis process. Now, can kidney start working again after dialysis? That question can rise in your mind. Most people with the chronic kidney failure gradually lose the function of their kidneys. The good news is acute kidney failure can often be reversed. The kidney usually start working again when several weeks to month after underlying cause has been treated. Dialysis. So now what is the real meaning of dialysis? What is dialysis? A kidney can filter 100 to 150 quarters of blood every day. If the kidneys are not functioning properly, waste starts accumulating in the blood. This results in coma and even to cause death. To cure this, the patient is subjected to allodialysis. The dialysis maintains the body balance in the following ways. One is its control blood pressure. Second one, it removes the excess water and the metabolic waste from the body. Third one is prevent chemicals such as potassium, bicarbonate and sodium from reaching hazardous level. So dialysis is used for the people with the critical kidney disorders, grave kidney damage, previously severe renal failure. It is required when a kidney loss 95% of efficient and has a glomerular filter rate of less than 15. This treatment may continue for a month or a year since most kidney failure are irreversible. Now you are seeing that the patient is taking the hemodialysis. That means hemodialysis means the catheter, the injected at the artery of arm and both the side. One is they have taken the blood which is given through the blood. It is indicated by the black color. The black color tube indicates that is a impure blood that have been taken from a vein. Through that pressure level is maintained by the atrial pressure monitor. Another one pump is given here. The pump blood pump, what is happening? It is directing the unclear blood towards the dialyzer. The dialyzer, it is having the what is the kidney processor having same kind of function have been done by the dialyzer. It will do ultrafiltration, secretion, another one's removal of waste, unwanted substance in the blood. Another one, it will maintain the blood temperature. So here what is they are, in order to remove the unwanted waste, they are adding saline solution to the blood. The saline solution, when it react with the blood, some of the unwanted things have been separated, that when it goes through the filter it will do the suck that pure blood, another unwanted waste and all have been removed. So it has been done by the osmosis method. Okay, another here you are seeing that used dialyzed machine. Another they are using a inflow pressure monitor. Finally, what is happening? So same as the pure, the cleaned blood have been passed through the catheter and injected into the same arm. So here, okay, this is okay, clean blood. So these one, they are that people who failed renal problem. These hemodialysis weekly once they have to go for cleaning their blood, or if it is a severe one, 3 days once they have to go to hospital, they have to clean the blood. It's highly some kind of complicated one. So here I am going to tell about the what is the principal dialysis. So the dialysis function on the ultrafiltration of fluid through a semi-permeable membrane, and the concept of dissipation of a solute. Diffusion is a characteristics of material in water that has a tendency to flow against the concentration gradient. Blood runs on one flank of the semi-permeable film, and dialysate or distinct dialysate fluid flow on the opposite flank. A selectively permeable layer is a skinny membrane of material that comprise pores of different size or holes. The minor solute and fluid follows the layer that membrane stop bath of bigger substance. So here, for instance, the large protein and red blood cells are there, but it is maintaining that one. This limits the filter producer that happen in the kidney when the blood moves into the kidney, and the bigger substance are divided from the minor ones in the glomerulus. However, the dialysis is not a permanent solution. Instead, it should be seen as a temporary alternative to substitute the kidney's function until the kidney can repair itself. But the chronic kidney damage will rarely heal itself, the only solution being a kidney transplant. The typical patient have a longer life expectancy if they opt for kidney transplant than dialysis. So hemodialysis, now this hemodialysis method is a patient's blood passed through the dialysis machine, and where it is purified and returned to its patient body. Peritoneal dialysis, we have already discussed. Peritoneal dialysis is done by a surgical implanting a catheter in the stomach of a patient. A cleaning fluid dialysate is then circulated through the catheter that absorbs the waste material from the blood vessels in walls of the stomach. It is then drawn out and discarded. Peritoneal dialysis is considered to be a more versatile and convenient than hemodialysis. So advantages of dialysis. Dialysis can be carried out Even at home, peritoneal dialysis is a comfortable method of dialysis that is easy to use. The equipment used in the peritoneal dialysis is less bulky, easy to carry along with the patients. Unlike the peritoneal dialysis, hemodialysis is not to be carried out everywhere. Seeing here is a hemodialysis. That is, hemodialysis is a diffusion of dissolved particle from one fluid compartment into across the semi-permeable membrane. The client blood flows through one fluid compartment and the dialysate is in another fluid compartment. Now, what is the dialysate? It will do cleans the blood of accumulate waste product, removes the byproduct of protein metabolism such as urea, creatine and uric acid, removes the excess fluid, maintain or restores the buffer system of the body, maintain or restore the electrolyte levels. So here you are seeing the patient is sitting on the chair who is taking a part of a hemodialysis. So machine have been given and artery part is taken unclean blood and vein part it is provides clean blood. So here where filter is taken place at a dialysate and you are seeing the hemodialysis machine. So what is the hemodialysis machine? Hemodialysis, also spelled hemodialysis or simply dialysis. It is a process of purifying the blood of a person whose kidney are not working normally. This type of dialysis achieves the extracorporeal removal of waste products such as creatinine and urea and free water from blood when the kidneys are in a state of kidney failure. Hemodialysis is one of the 3 renal replacement therapies, the other 2 being kidney transplant and peritoneal dialysis. An alternative method for extracorporeal separation of blood component such as plasma or cell is appraisal. And the principle of hemodialysis. What is the principle of hemodialysis? The diffusion is a movement of particle from an area of greater concentration to one of lesser concentration. Osmosis is the movement of fluids across a semi-permeable membrane from an area of lesser concentration of particle to an area of greater concentration of particle. Ultrafiltration is the movement of fluid across a semi-permeable membrane as a result of artificially created pressure gradient. A dialysate bath is composed of water and major electrolytes. The dialysate need not sterilize because bacteria are too large to pass through. However, the dialysate must meet specific standard and water treatment system are used to ensure a safe water supply. Hemodialysis can be an outpatient or inpatient therapy. Routine hemodialysis is connected in a dialysis outpatient facility, either a purpose-built room in a hospital or a dedicated, a stand-alone clinic. Less frequently hemodialysis done at home. Dialysis treatment in a clinic are initiated and managed by the specialized staff made up of nurse and technicians. Dialysis treatment at home can be a self-initiated and managed or done jointly with the assistance of a trained helper who is usually a family. There are three types of hemodialysis. One is conventional hemodialysis, second one is daily hemodialysis, third one is nocturnal dialysis. Now you are going to observe the dialysis set. So here first you will discuss conventional hemodialysis. What is conventional hemodialysis? The conventional hemodialysis is usually done 3 times per week for about 3 to 4 hours for each treatment, sometimes 5 hours for larger patient, during which patient's blood is drawn out through a tube at a rate of 200 to 400 milliliter per minute. The tube is connected to a 15, 16 or 17 kg needle inserted in the dialysis fistula or graft or connected to one port of a dialysis catheter. The blood is then pumped through the dialyzer and then the processed blood is pumped back into the patient's bloodstream through another tube connected to a second needle or port. During the procedure, the patient blood pressure is closely monitored, and if it became low or patient developed any other sign of low blood volume such as nausea, the dialysis attendant can administer extra fluid through the machine. During the treatment, the patient entire blood volume about 5000 cc circulates through the machine every 15 minutes. During this process, the dialysis patient is exposed to a week's worth of water for average. The dialysis, second we are going to see the daily dialysis. The daily dialysis, hemodialysis, it is typically used those patients who do not their own dialysis at home. It is less stressful, more gentle, but do not require more frequent access. This is simple with the catheter but more problematic with the fistulas or grafts. The buttonhole techniques can be used for fistulas requiring frequent access. Daily hemodialysis is usually done for 2 hours, 6 days a week. Third one, you are going to see the nocturnal hemodialysis. The procedure of nocturnal hemodialysis is similar to the conventional hemodialysis, except it is performed 3 to 6 nights a week and between 6 and 10 hours per session while the patient sleeps. So you are seeing the blood with the waste product. It has been dialyzed. The waste products passes through the membrane through osmosis method and it is already given. So the unclean blood is taken from arteries. The line artery from apparatus you are seeing in the diagram. It has been pumped through the dialyzer. In the dialyzer, there is a water is added. And so this is that, and the tubing selective permeable membrane is given. After that, the dialysate has been added with the unclean blood. After that, given to the membrane it will with the help of pressure, the unwanted products and all removed. The clean blood have been counted. After that, there is vitamins and other ingredient will be given to the blood. It has been come as a clean blood. It is injected through the vein. Here the principle of dialysis. Dialysis equal to solute positively diffuse down concentration gradient. Dialysate flow counter current to the blood flow. Urea, creatinine, K ions move from blood to dialysate. A calcium and bicarbonate move from dialysate to blood. Hemofiltration uses hydrostatic pressure gradient to induce filtration, convection, plasma water and solute across the membrane. Hemodialysate filtration, combination of dialysis and filtration. The mechanism of dialysis and its techniques. The principle of hemodialysis is the same as the other method of dialysis. It involves the diffusion of solute across the semi-permeable membrane. Hemodialysis utilizes counter current flow where the dialysate is flowing in a opposite direction to the blood flow in the extracorporeal circuit. Counter current flow maintains the concentration gradient across the membrane at the maximum and increase the efficiency of dialysis. Fluid removal or ultrafiltration is achieved by altering the hydrostate pressure of the dialysate compartment, causing free water and some dissolved solute to move across the membrane along a created pressure gradient. The dialysis solution that is used may be a sterilized solution of mineral ions, urea and other waste product, potassium and phosphate diffused into the dialysis solution. However, concentration of sodium and chloride are similar to those of normal plasma to prevent loss. Sodium bicarbonate is added in a higher concentration than the plasma to correct the blood acidity. A small amount of glucose is also commonly used. Note that this is a different process to the related techniques of hemofiltration. The diagram you are seeing is a semi-permeable membrane and a diffusion have been take place. The unwanted particle have been given as a red color disc. So dialyzer, this is the dialyzer machine. You are seeing that it is having a blood inlet wall and blood outlet wall. Here there is a n number of membrane. It is made up of fiber and it is covered by jacket, and solution is it has been absorbed with the help of a fiber membrane. After that there is a tube sheet, and a tube sheet it produces a pressure. So here and they are injecting the dialysate solution in the inlet. Okay, and once it is added, the unwanted product have been removed. So here what is that? Here the dirty blood is enter the dialyzer here in blood inlet, and a dirty fluid, the dialysate containing the waste from your body goes to the drain. Membrane, next stage is membrane, contains the human blood. Each membrane has tiny holes that the waste can move out of, but the important thing is like a blood cell and protein stay inside the membrane. The third stage, the clean the fluid, that is the dialysate, enters the dialyzer here and surrounds each membrane, cleans human blood as it travel up the dialyzer. So clean blood is returned to back to human body. So dialyzer, final one, what is the dialyzer? We have learned the dialyzer is a piece of equipment that actually filters the blood. Almost all dialyzer in use today are hollow fiber variety, a cylindrical bundle of hollow fiber whose walls are composed of semi-permeable membrane is anchored at each end into porting compound. That this is assembly is put into a clear plastic cylinder shell with 4 opening, 1 opening or blood port at each end of cylinder communicate with each other end of the bundle of hollow fibers. This forms the blood compartment of dialyzer. The 2 other ports are cut into side of the cylinder. These communicate the space around the hollow fibers, the dialysate compartment. The blood is pumped via blood ports through this bundle of very thin capillary like tubes, and the dialysate is pumped through the space surrounding the fiber. The pressure gradients are applied when necessary to move fluid from the blood to dialysate component.